Thank you, Chairwoman DeGette. Today, the committee will continue our oversight of the ongoing COVID-19 response by hearing from frontline healthcare workers who have served their communities throughout the pandemic. Their experiences offer valuable insights into our current response and ways we can better be prepared for future public health emergencies. Now, nearly 4.5 million Americans have been hospitalized due to COVID-19, and more than 930,000 Americans have lost their lives. No one has been unaffected by the pandemic, though seniors have been particularly vulnerable to the disease, and communities of color have faced disproportionate impacts. Essential workers and frontline responders, such as the healthcare workers joining us today, have faced additional risks and burdens. Over the last 2 months, the Omicron variant ripped through our communities, spreading quicker than prior variants. While Omicron appears to have peaked, the experience has shown that we must remain vigilant as new variants emerge, and we have to continue to use the tools available to us to prevent transmission of COVID-19 and protect the most vulnerable among us. Now, evidence shows that being fully vaccinated and boosted is the most effective way to fight COVID-19 and its impacts on our community. This remained true even during the spread of Omicron variant, where unvaccinated Americans continue to face a greater risk of severe disease and death than those fully vaccinated. Yet today in the United States, only 69% of eligible Americans are fully vaccinated, and just 45% have gotten a booster dose. So I look forward to hearing from our witnesses about the efforts they found successful in encouraging people to get the vaccine and the booster dose. Because unfortunately, despite all the available tools, the pandemic continues to substantially strain our nation's healthcare system. The pandemic is exacerbating long-standing workforce shortages, capacity issues, and barriers to access for people of color and other underserved communities. As COVID-19 surges caused patients to overwhelm hospitals and medical facilities, healthcare workers have faced both mental and physical challenges. They're experiencing work overload, burnout, and increased anxiety or depression, with women, Black, and Hispanic healthcare workers reporting higher stress. And as different variants have emerged, hospital capacity has at times surpassed the number of staff beds available. So this week, more than 75% of ICU beds in hospitals across the United States remain occupied, despite the fact that the Omicron wave has crested. And this strain not only adds to healthcare workers' burden, but can affect patient care and potentially their health. Capacity constraints, fear of contracting COVID-19, and other barriers to healthcare led to 4 in 10 adults delaying or avoiding medical care in the early days of the pandemic. 1 in 8 adults, and an even higher rate for Black and Hispanic adults, postponed emergency care. And delayed preventative care and diagnosis can lead to chronic life-threatening illnesses. As the pandemic continues, we must contend with these broader and longer-term impacts on Americans' health. Fortunately, Congress and the Biden administration have taken action to support America's healthcare workforce and protect the health and safety of all Americans. The American Rescue Plan and the CARES Act provided billions of dollars in funding to address worker retention and wellness, and resources for healthcare providers serving children, low-income individuals, and seniors. And then last November, this committee passed legislation that would provide support to the healthcare workforce and expand access to important preventative services. The House passed Build Back Better Act also included key provisions to invest in public health infrastructure and the healthcare workforce. The Biden administration has also made hundreds of millions of tests and masks and COVID-19 vaccines and therapies available to Americans at no cost. The president talked even more about what he plans to do in the future last night. And these are critical steps to supporting the nation's healthcare system and the public's health, but more must be done to ease the burden on healthcare workers and bolster capacity. So I just wanted to say, Madam Chair, I'm grateful for the tireless commitment our nation's healthcare workers have shown for the last 2 years, and look forward to hearing from our witnesses about their experiences on the front lines. Together we can strengthen America's continued response to the COVID-19 crisis. If I could just say, Chairwoman DeGette, I know that many times you've approached me and talked about how we have to be better prepared. And I know that even before the pandemic, when it started a couple years ago, you were talking to me about, long-term preparedness for viruses and other healthcare emergencies. And I appreciate the fact that you and the members of the committee in general, want us to think about the future. Right now, everybody's saying, oh, everything's great, right? It's not. We still have a lot of problems. But more important, and this is what you've always stressed, Diana, we have to think about, the next pandemic or the next wave. And this is a very important part of this committee's function. So thank you.